We want to bring in Dr. Luiza Petre now. She is a cardiologist and assistant clinical professor of cardiology at Mount Sinai School of Medicine. Dr. Petre, we appreciate you being here today. We've had this news today about the CDC saying they're seeing more evidence of a possible link between these mRNA COVID vaccines and cases of heart inflammation, particularly in some young men. Walk us through what exactly this condition is and what normally causes it.
Indeed, the CDC is supposed to meet next week on this emergency meeting to discuss this side effect noticed recently in younger male around 4 or 5 days after their mRNA vaccines. And so far, we had reported 470 cases. But let's understand what this is, myocarditis. It's an inflammation of the muscle of the heart. And some cases also are associated with inflammation of the layer surrounding the heart, pericardium, and that's called pericarditis. So the most common symptoms are chest pain, shortness of breath occurring in these people. But the question that CDC has to answer next week, number one, is this direct correlation? There is evidence that preliminary, we have more cases than expected in the background population usually because this myocarditis happens after certain viral infections like infective virus, sometimes after the flu. So this is question number one. Question number two, what is the mechanism of this? Is an inflammation triggered by vaccine itself, or is an autoimmune response like we had the clotting disorder side effect? Because that would answer the question, is the treatment going to be any different? And the most important question is when it comes to children, do we have to change the dosing in these children? Do we need to give lower doses to prevent this side effect?
Well, Doc, I do want to ask you, why do you think this is presenting itself more in younger people than in people who are maybe over 30? It seems a bit strange.
The question really comes if we are not recognizing the patients older. Like, for instance, I had a woman patient in her 60s who came with chest pain in my office. And the first thing that comes to your mind, she might have coronary artery disease. She's in the perfect age group to have a small heart attack. She was in a hospital. She had positive enzymes. And then we did not find any blockages. No, actually, I'm sending her for an MRI to see if actually she did have myocarditis. Because when a child comes with chest pain, that's unusual. That's unexpected for that age. So are we just recognizing this more in children?
All right, I understand. Dr. Luiza Petre, cardiologist, we appreciate your time today. Thank you.